everyone. My name is Betty Hernandez, first year college from BSN 1B. So now I'm going to demonstrate to you the assessing the peripheral vascular system of our patient. So first I'm going to introduce myself to my patient and verify her name. So good day ma'am, I'm Betty, your student nurse for today. So may I ask what is your name?
Yes, I'm Vanessa Joy.
How old are you?
17.
So next, I'm going to explain to my client what we're going to do and why it is necessary. So today ma'am, I'm going to assess your peripheral vascular system. Is that okay to you?
Okay.
So the rationale of this is for the patient awareness and what we're going to do and why it is necessary. So next, we're going to do the hand hygiene. So the rationale of this is to avoid the spreading of microorganisms or cross-contaminations among patients or clients. Okay, so next we need to provide for client privacy. So the rationale of this is for the patient to be comfortable in the whole procedure. For example, close the door or close the curtains. Okay, to summarize all the procedure that we will be doing, first we're going to palpate the peripheral pulses, except the carotid pulse on both sides of the client's body, individually, simultaneous, and systematically, to determine the symmetry pulse volume. Next, we're going to inspect the peripheral veins in the arms and legs for the presence and or appearance in the arms and legs of the superficial veins when limbs are dependent and when limbs are elevated. So next, also we're going to assess the peripheral legs veins for the signs of phlebitis. Next, we're going to inspect the skin of the hands and feet for color, temperature, edema, and skin changes, and all adequacy of arterial flow and arterial insufficiency is spotted. So after all the procedure, we're going to document the findings in the client record. So now we're going to start our procedure. Okay, so now we're going to observe the arms for the size and the venous pattern. Also look for any edema. So ma'am, can I see your hands? Okay, so the arms are bilateral symmetry with minimal variation in size and the shape, and there are no any edema presence or any prominent venous pattern. Everything is normal. Okay, so next we're going to observe the coloration of the hands and arms. So ma'am, can I touch your hands? Okay, so the color of the hands and the arms is same with her skin tone. It is same and bilaterally. Okay, next we're going to palpate the client's fingers, hands, and arms and observe the temperature. Ma'am, can I touch it? Okay, so everything is normal. The skin is warm to touch bilaterally and from fingers to the tips of the upper arms. So now we're going to palpate the radial pulse of our patient. Okay, so the radial pulse of our patients are bilaterally strong to plus, and also the artery walls have a resilient quality. So now we're going to palpate the ulnar pulses. Okay, the ulnar pulse may not be detected, but it is. Okay, so now we're going to palpate the brachial pulse of our patient. Okay, so the brachial pulse is normal. It has equal strength bilaterally. So next, we're going to palpate the epirich layer lymph nodes. Okay, so everything in the epirich layer lymph nodes are normal, but though sometimes it is not palpatable, but it is normal. Okay, so next we're going to observe for the skin color while inspecting both legs from the toes. So, ma'am, pwede po ba kayong humiga? Nakirelax po yung kain. Okay, so everything is normal. It has pink tones visible, and there is no changes in pigmentation. So now we're going to inspect the distribution of hair on legs. Okay, so it is normal. The hair covers the skin in the legs, and it appears in the dorsal surface of the toes. So next, we're going to inspect for any lesions or ulcers. Okay, so legs are free of any lesions or any ulcerations. So now we're going to inspect for any edema. Okay, so everything is normal. The size is identical. The shape is bilaterally. No swelling or any atrophy detected. So next, we're going to palpate the edema, if there them. Okay. Okay, so there is no edema detected, pinning or non-pinning presence in the legs of our patient. So now we're going to palpate the bilaterally for temperature of the feet and the legs. Okay, so toes, feet, and legs are equally warm bilaterally. So next, we're going to palpate the ephemeral pulses. Okay, so ephemeral pulses are strong and equal bilaterally. Okay, so now we're going to palpate the popliteal pulse. Okay, so everything in the popliteal pulse is normal and bilaterally. So no abnormal findings detected. So now we're going to palpate the dorsal pedis pulse of our patient. Okay, so the dorsal pedis pulse are bilaterally strong and it is normal. Now we're going to palpate the posterior tibial pulses. Okay, so everything is normal. It is strong bilaterally. Everything is normal with the posterior tibial pulses of our patient. Okay, so lastly, we're going to inspect for any varicosities and any thrombophlebitis with our patient. So ma'am, can you please stand up po? Tayo lang po kayo. Okay, pwede na po kayo. So, veins are flat and barely seen under the surface of the skin and everything is normal. So, next we're going to document all the relevant things. Okay, so after the documentation, we're all the procedures are done. So that's how I demonstrate to you how to assess the peripheral vascular system with our patient.